Hi everyone, I'm Dr. Erin Katribe and I'm the Director of National Veterinary Programs for Best Friends Animal Society. Today I want to talk to you about vaccines and preventive care in animal shelters. It is so much easier to keep animals healthy than it is to actually treat disease in animal shelters. So let's talk about what every shelter, regardless of your size or even your veterinary involvement, what you should all be doing. And you heard me right, even without a vet on staff you can and you should be doing some things that we'll discuss today. First, we'll start with intake. The moment of intake to the shelter is critical to disease prevention. So what are we doing on intake? First is going to be a physical exam by trained staff. This does not have to be a veterinarian or even a veterinary technician, but just has to be staff that are trained to know what they're looking for. We want to scan for a microchip, assess for any other identification that could mean there's a potential owner that we can try to contact. And then we're giving vaccines. So these need to be given immediately upon intake, not days later, ideally not even hours later, but right away on intake, even before intake if we have the opportunity to do that. We want to administer deworming at intake as well. We have some prophylactic recommendations for all pets that we'll talk about in a little bit. And this may be when we decide to do some screening tests. So we do recommend heartworm testing for all dogs that are older than 6 to 7 months of age. And intake might be a good time to do this to avoid repeated handling that can be stressful and can be inefficient sometimes in shelters. And then what about feline leukemia FIV testing? We actually don't recommend routine screening of all cats anymore, and so we'll talk about this later. Shelter vaccination. So as I mentioned, we want to vaccinate on intake or even before, and we want to choose modified live vaccines for any vaccines and diseases that we have an option to do that for. They stimulate a stronger immune response and they work faster than other types of vaccines. So look for modified live vaccines. We want to vaccinate according to a shelter-specific schedule, and we'll talk about exactly what that schedule is. We want to store and handle our vaccines appropriately. If we don't do that, then they can lose efficacy. And we want to make sure to use our medical records and our reminders so that we're giving additional doses of vaccines on an appropriate schedule and we're not missing anybody and that we're not late on those vaccines. So here's what the shelter guidelines for vaccinations say. So for DHPP for dogs and FERCP for cats, we're going to start at 4 weeks of age in all animals. It may be even sooner. There's some updated guidelines that allow for vaccines even earlier than 4 weeks of age, as early as 1 day of age, if we have really, really high-risk situations. But currently, the guidelines say 4 weeks. We're going to give additional doses every 2 to 3 weeks until those juvenile animals reach 18 to 20 weeks of age. And something that is also different than a private practice recommendation, adults get a dose on intake, but they also get a second dose. We are going to administer Bordetella and parainfluenza in dogs only, and we want to choose an intranasal or an oral vaccine. That one can be given an intake for dogs that are 3 to 4 weeks of age or older based on how the vaccine is labeled. We want to give rabies ideally in a shelter situation. However, there's obviously restrictions around who can give that depending on the state. And this isn't a disease that I'm worried that these animals are going to actually contract while they're in our care. It's important for public health concerns. And so we do ideally want to give it at the time of adoption, right? So they go out vaccinated for that. Typically it's 3 to 4 months of age or older, but this one I'm not as worried about giving immediately upon intake like I am the other vaccines. Some vaccines that aren't routinely recommended are going to be the chlamydia component that you can sometimes find in FERCP vaccines. We don't need to worry about that one. We don't routinely recommend influenza, even in the face of an outbreak. This isn't a vaccine that is worthwhile for shelters to typically give. And then leptospirosis. So this may change in the future depending on if it's a disease that's endemic in your area, but as of right now, it's not a vaccine we recommend regularly or routinely in shelters. So let's talk about vaccinating young animals. So when puppies or kittens are born and with early nursing, they will get maternal antibodies from mom if mom was protected against that specific disease, meaning she was vaccinated, or maybe she was even infected at some point. If mom never encountered that disease and was never vaccinated, then she won't be protected, and those young animals won't actually get any early protection. The challenge with maternal antibodies is if a puppy or kitten gets them, they can provide some early protection against those diseases, but they also interfere with vaccination, meaning if we vaccinate while maternal antibodies are hanging around, that vaccine that provides long-lasting protection won't work. Those maternal antibodies decline with time, and so they're only going to protect a puppy or kitten for a few weeks after birth. How fast those decline is going to be unpredictable, and it can be different with individuals and even within puppies and kittens of the same litter. However, we do know in all animals that they're gone at 16 weeks of age. A common thing that I hear in shelters. So this puppy has had 3 vaccines, so he's protected. We don't need to wear gloves anymore. We don't need to worry about him getting infected with parvo. And is that true? And the reality is it's not. We don't know for sure that he is, and this has to do with those maternal antibodies. We can't know for sure that puppies or kittens are protected until they've reached that 16-week age mark and they've had 2 vaccines given at 16 weeks of age or older. So we know if they have maternal antibodies they got from mom, those maternal antibodies are all gone by 16 weeks of age. So we know our vaccines given later than that are going to be effective. Maybe those vaccines that we gave at 4 weeks of age and 6 weeks of age, maybe those are effective, but maybe they're not, right? And so we don't know for sure until those animals are older than 18 to 20 weeks of age. The number of vaccines doesn't matter. It doesn't matter that a puppy or kitten has had 5 vaccines. If they're not older than that 16 weeks of age and have had 2 vaccines since 16 weeks, we don't know for sure. Common question. Who gets vaccinated in the shelter? So first we'll start with say we have 6-week-old puppies and kittens. Do they get vaccinated? The answer is yes, they absolutely get vaccinated. What about nursing moms and pregnant moms? And the answer there is yes, they get vaccinated. What about animals with mild to moderate signs of illness, for example, upper respiratory disease, or maybe they're having some diarrhea? And the answer is shelters are high-risk environments, and so yes, animals with signs of infectious disease still get vaccinated. Sick animals still get vaccinated. And then what about puppies or kittens that are neonates, that are younger than 4 weeks of age? And the answer there is it depends. It depends on how high risk our environment is, but maybe animals even younger than 4 weeks of age get vaccinated. So nearly everyone gets vaccinated in the shelter. In order for our vaccines to be effective, we have to store and handle them appropriately. So let's keep them in a refrigerator, and we actually recommend a full size or a medical fridge. We love these little convenient dorm fridges in shelters because we can put them in areas, for example, in our intake area. But the reality is they do not maintain stable temperatures very well, and sometimes they can freeze. And so we actually recommend either a full-size fridge or medical grade refrigerators like the one shown here. And they do come in smaller models if we need to put them in convenient places. I recommend monitoring the temperature, including the minimum and maximum, to make sure we're staying within the recommended range. And if we're taking vaccines out into the shelter, for example, to administer our additional doses to a lot of dogs, we want to make sure that we put those in a cooler. For our vaccines that we have to mix up, so our FERCP, DHPP, Bordetella, we want to mix those immediately before administering. After about 30 minutes to an hour, they can start to lose efficacy. And so we want to make sure we're mixing them up right away. I know we love to be efficient, but we cannot mix all the vaccines for the entire day and just stick them in the fridge and give them throughout the day. We need to mix them right before. Here's a deworming schedule. So we recommend that all animals get pyrantel on intake. And for puppies or kittens, we're going to keep repeating those doses. For puppies and kittens, we also, in most shelters, we see a lot of coccidia. And so drugs like panazeryl or toltrazuril, we can give on intake and potentially repeat another dose. And that is because coccidia can be such a problem and can really profoundly affect our puppies and kittens and can make them really, really sick. The shift now for FeLV, FIV testing has been from the shelter setting to testing in the post-adoption setting in a private practice clinic. The reasons for this are several. First, a positive test in a healthy cat is more likely to be a false positive. This means this healthy cat we've now labeled with an infectious disease that it actually doesn't have. Now, we can do confirmatory testing to sort of start to try to figure this out. These diseases are complex and testing is not perfect and it's expensive. And so, again, we've recommended that we actually shift this testing to the adoptive setting. That gives the time and space for a veterinarian to have a conversation with an adopter about those test results, about confirmatory testing, and shifts that burden from the shelter. This allows us to reallocate resources. And I think it's also important to know test results, both positive and negative, for both diseases can be really complicated to interpret and can be really unreliable in kittens. These diseases are so complex. And so we no longer recommend testing all healthy cats on intake. We do, however, recommend heartworm testing, so an antigen test for all dogs over 6 to 7 months of age. And we recommend heartworm prevention in all animals. Ideally, we're doing this in cats too if we live in endemic areas, but it's particularly important for dogs. Most of these preventions are labeled for 6 to 8 weeks of age and older. Now, if you're wondering about sample protocols, we have some intake protocols to share with you. You can check out that as well as a number of other disease protocols for use in shelters, and you can tweak them and adapt them for your shelter working with a veterinarian, and you can see those templates here. And if you need help adapting those protocols, if you have disease questions, the Best Friends National Shelter Medicine team is here to help you. So you can reach out to us in sheltermedicine@bestfriends.org, and we'd be happy to help you with any of your disease questions or your challenges in your shelters.